Hello, I am Biddut Bhattacharya, audiologist, talking about tuberculosis and hearing loss, which is very common nowadays in my daily OPDs. So, tuberculosis in general, it is a primary, in case of primary treatment, the patients are not having much hearing loss problems, which I have been observed in my outpatient door. But some patients which have drug-resistant tuberculosis, means they are coming after failing the first dose of tuberculosis medicines. So after second line of treatment, that's drug-resistant tuberculosis, which is very much harmful for hearing problem, because those type of drugs are, as we all know, called the aminoglycoside group of drug or polypeptides type of drugs, which affects the hearing loss very adversely. So I have seen different age group levels of patients. Initially they are having the high frequency hearing loss case, but later on it gradually develops in the more of degree of hearing loss. It increases as the course of drug also increases. So recently I have seen one patient under amikacin injection since March, after around about 6 months. So it is almost more than 90 decibel hearing loss. It is called profound hearing loss. Age about 60 years of age, young 60 years of age lady. So actually in case of tuberculosis, that in initial treatment there is not much harmful for hearing loss, but in the second line of treatment, those called drug-resistant tuberculosis, that affects hearing very badly. So actually in those cases, it is better if the drugs immediately can be stopped or do some other treatment, but it is a life-saving case. So there are some other complications also, nephrological or hepatological, but those complications might be cured. But hearing loss, once it is affected, it is irreversible. It affects permanently. So that has to be managed by some other hearing loss treatment, by hearing aids or any other rehabilitation program. So tuberculosis patients are nowadays very common. In initial stage, we must do hearing loss. It is routinely check-up of hearing before the starting of the treatment, and after 6 months of the treatment, we must review the hearing history of the patients, how much the status about the type of hearing loss or degree of hearing loss, because the hearing loss is a social problem. Once a person gets hearing problem, he has a communication disorder, so it becomes a social issue. So try to look out about this tuberculosis and hearing loss matter for our professionals, for both otolaryngologist and audiologist in their workplace, that I have been experienced with these tuberculosis cases that I share with our professionals. So kindly comment if there is any good suggestion for your latest information regarding tuberculosis and hearing loss. So thank you all.